Gentlemen, have you wondered why some couples stay safe for years, even when one partner tested positive, while others feel anxious after encounters? Safety goes beyond a condom. It comes from 3 techniques: physical, emotional, and scientific. U.S. EERs handle 155 IMA visits yearly. In 2023, a 39K new HIV diagnoses, 181% men. In this video, you'll learn doctor-approved methods men weren't taught, habits that protect you, your partner, and your peace of mind. If you've ever felt nervous after intimacy, this message will give you calm and control again. If you value truth over myths, hit subscribe and comment SAFE to join a smarter generation of men. Stay with me until the end. I'll expose a post-shower habit that undermines protection and the quick fix that keeps your body healthy and responsive at any age. One subscription helps us reach 1,000 and to keep delivering useful guidance. Let's clear the noise for a moment, gentlemen. You don't need expensive products or confusing internet myths. What truly protects you is understanding how your body, your skin, and timing already defend you when used wisely. Once you master these foundations, safe sex stops being fear-based and becomes a confident, informed daily practice grounded in real medical truth. A few days ago, a young man found my work, booked a visit after researching his health, and felt confused about what truly keeps him safe. He sat down and said, "Doctor, I can't believe this. Have I misunderstood protection all along? True prevention begins before contact, and it starts with you. Self-care, awareness, and respectful hygiene that protect the body's natural defenses. Your first protective wall is intact skin. When skin is hydrated and unbroken, it blocks pathogens efficiently, like a sealed door that simply refuses to let trouble in. The second wall is healthy mucosa, moist, elastic tissue lined with sentries. When calm and cared for, it resists micro-injury and lowers the chance a virus can slip through. Micro-tears are the hidden gateway. They appear with friction, dryness, harsh products, or aggressive grooming, creating openings you never see but a virus does not miss. That is why gentle washing before and after intimacy matters. Use lukewarm water and a mild, pH-balanced cleanser. Never scrub, and avoid alcohol wipes that strip oils and irritate tissue. Hydration keeps skin and mucosa resilient. Drink water and choose a light, fragrance-free moisturizer when needed, allowing the surface to remain supple rather than brittle. Timing your grooming choices matters as well. Shaving immediately before sex increases irritation and microscopic nicks. If you groom, do it a day earlier and use a soothing, alcohol-free aftercare. Balance also protects. Many products labeled fresh are surprisingly harsh. Soaps with heavy fragrance or high alkalinity disrupt pH and promote dryness, the exact conditions that increase risk. I told him the goal is not sterility, it is stability. When your barriers are calm and intact, every other prevention step works better and feels easier to maintain. The first barrier against HIV isn't latex, it's your own skin. If this surprises you, comment barrier and tell me whether you have ever considered skincare a core part of safe sex. After a short conversation, the young man became more relaxed and finally shared what had been on his mind. He said, "Doctor, I didn't realize that time itself could be a risk factor. No one ever told me that timing matters as much as protection." I smiled and told him he was not alone. Most men misunderstand this exact point. You see, time equals risk. When someone is newly infected, their viral load is extremely high, especially during the first few weeks of infection, the so-called acute phase. During that short period, the chance of transmission skyrockets, even if the exposure seems small or unplanned. That is why the first rule I teach is called the timing rule. Avoid unprotected contact during unknown status periods or right after a possible exposure. Even a few weeks of patience can save a lifetime of worry. Science shows that waiting for a confirmed negative test result, typically 4 to 6 weeks after potential exposure, reduces risk by almost 80%. That time allows your immune system and diagnostic tests to show reliable results, protecting not only you, but also anyone you love. Think of time as a second form of protection, equal in value to a condom. It demands discipline, awareness, and respect. When you give your body time to confirm safety, you act not from fear, but from wisdom. You protect your peace of mind as much as your health. I told him, respect time like you respect protection. Both create space for safety and confidence. He nodded slowly and said, "So, doctor, patience really is part of prevention." Exactly, because every wise man learns that true protection isn't just what you wear, it's when you wait. A few weeks of patience can save you a lifetime of anxiety. A few minutes later, a couple arrived with the same concern, and I used their question to clarify what many men miss in the first 30 seconds of guidance. Condom plus lubricant equals a real shield, not a suggestion. Together, they reduce friction, prevent micro-tears, and cut down slippage, the tiny failures that turn good intentions into avoidable risk. When tissue stays moist and glide is consistent, the skin and mucosa remain intact, and the virus has fewer places to enter. Use water-based or silicone-based lubricants. Never use oils with latex. Oils weaken latex, making microscopic holes and increasing breakage under stress. A pea to nickel-sized amount is enough to start, then reapply lightly as needed. If you are circumcised and tend to dry out, plan ahead. If you are uncircumcised, gently retract and maintain glide without overstretching delicate tissue. Do a quick condom check every time. Confirm the expiration date. Feel for a tiny air bubble to ensure the package is sealed, and open with fingers, not teeth or keys. Pinch the tip to keep space for semen, roll down smoothly to the base, and add a little lube outside to maintain glide. After ejaculation, hold the base, withdraw while still firm, and remove carefully away from your partner. One condom equals one act. Never stack or reuse. Store them cool and dry, not in a wallet or car glove box. Used correctly and consistently, condoms are about 98% effective at preventing pregnancy and significantly reduce HIV risk, especially with proper lubrication and no breaks. Technique transforms a thin layer of latex into dependable protection. Choose the right size. Too tight fit stresses latex and breaks. If latex allergic, choose polyisoprene or polyurethane and still use lubricant. Skip numbing sprays. Reduced sensation causes friction injuries and unnoticed tears. Fit matters for safety. 2 layers of smart choices. 1 powerful shield. Comment "shield" if you are committed to mastering protection instead of guessing it. The issue isn't men. It is information. Too little taught, too many rumors, and no practical routine to guide everyday choices when desire is loud and memory grows selective. Prevention improves the moment we replace gossip with a simple, repeatable plan anyone can follow without shame. Communicate clearly, test routinely, and document results you can reference later. Technique 3 is exactly that. Communication plus routine testing. The prevention. 3. Zero standard that protects bodies, calms minds, and strengthens relationships through predictable habits rather than last-minute improvisation. Test every 3 to 6 months, even when you feel fine. Put reminders on your calendar and keep the appointment, because consistency turns anxiety into reliable data you can trust. For routine checks, use 4th-generation antigen-antibody tests. After a recent possible exposure, add an early HIV-1 RNA test, then repeat the 4th-generation test at the correct window period. Ask your partner, when was your last test and what type was it? Offer your dates first. Leadership through transparency builds trust rather than defensiveness, guilt, or inconvenient silence. Store results in a secure notes app, not vanishing chat threads. Documentation prevents confusion, avoids arguments later, and supports clear decisions when passion seems louder than caution or memory. Testing is not mistrust. It is maintenance, like changing brake pads before a trip. Protection fails when we skip service intervals and hope luck covers the gaps without consequence. Agree on boundaries the same way. What's on the table with condoms and lube, what is not, and how either of you can pause immediately if discomfort or bleeding appears. Use the 2-yes rule. Both partners say yes to the act and yes to the plan. Protection, lubricant, aftercare, so consent includes safety, not only desire and excitement. If anxiety lingers afterward, schedule a 24-hour debrief. Review protection, note any issues, decide on testing, and record next steps calmly before memories blur and stories harden into fear. Openness shortens distance. Honesty gives both partners dignity and choice together. Real confidence doesn't come from guessing, it comes from knowing. Many of you have waited for the simplest answer. Strong immunity is your silent armor, built daily through sleep, nutrition, stress control, and micronutrients, rather than occasional heroics when trouble arrives. Aim for 7 to 9 hours of consistent sleep. Immune signaling, hormone balance, and tissue repair depend on it, and men who shortchange sleep chase solutions a rested body would accomplish reliably. Eat protein with colorful plants each day. Lean meats or legumes, olive oil, nuts, and berries. Think fiber for gut balance and energy, because inflamed, undernourished tissue is more vulnerable to micro-injury and slower to heal. 2 micronutrients stand out: vitamin D for immune modulation and mucosal integrity, and zinc for repair and antiviral pathways. Check baseline labs, then supplement with your clinician, not high-dose guesswork from the internet. Manage stress with simple tools: brief sunlight and a 10-minute walk, 5 slow breaths before decisions, and an unplug ritual 90 minutes before bed. Calmer cortisol means calmer tissue, fewer micro-tears, and better arousal when it counts. After sex, follow clean habits that protect barriers instead of punishing them. Urinate to flush the urethra, rinse gently with lukewarm water, then pat dry. Moisturize lightly with aloe or unscented lotion to keep tissue supple. Gently. Healthy mucosa resists viral entry. Hydrated, elastic tissue distributes pressure evenly and prevents microscopic fissures, while dry or inflamed tissue concentrates friction like sandpaper. Small daily choices quietly shift risk more than dramatic last-minute fixes. Mini hook number 6. Protection starts before the bedroom and lasts after. Now, the promised tip many men never hear. Harsh antibacterial soaps strip protective oils and leave micro cracks. Skipping drying invites fungal overgrowth in warm folds and frustrates sensation and confidence the next time. The fix is simple and powerful. Use a mild pH-balanced cleanser. Rinse, pat thoroughly dry, and moisturize lightly. This small routine strengthens your barrier, improves sensation, and keeps him healthy for years with minimal extra effort. As a physician, I don't see sexuality as optional. When men understand it, they age slower, recover faster, and carry steady energy that supports wiser choices, stronger bonds, and lower risk during moments that determine health and confidence. Anxiety is not protection. It tightens muscles, dries tissue, and drives rushed decisions that skip timing, ignore lubricant, or forget boundaries, leaving partners less safe and less connected than they hoped when the night began. Fear ruins intimacy because the mind directs body chemistry. Stress hormones raise blood pressure and narrow attention, while trust and presence lower reactivity and help us notice pain or friction early enough to pause and protect. Before intimacy, use my 3-breath reset. Inhale through the nose for 4, hold for 4, exhale for 6. Repeat 3 times while scanning the jaw, shoulders, pelvic floor, and hands for needless tension. Quietly say, "Slow is safe," then decide after the final exhale. This cue restores parasympathetic tone, improves natural lubrication, and sharpens how you read a partner's microsignals so consent, comfort, and timing stay clear. If you were raised with sexual taboo, old guilt may return. Notice it, name it, and ask, is this belief protecting me or shaming me into silence when we should be planning together? Principles should guide respect and boundaries, not sabotage calm dialogue about condoms, test dates, or a quick pause if discomfort or bleeding appears midway through the experience. When thoughts spiral, use a reality check. What is our plan? What are we sensing? And what is the next safe step? Fear hates specificity, and clarity turns threat into a checklist you can execute together. If this message helped, leave a comment so I know you received it and can build tools you actually use, not slogans that vanish when pressure rises and breath shortens. Your feedback guides future lessons. Calm is protection too. Your brain controls your body's chemistry. Speaking as a physician and as a man, here is a 60-second message I want every couple to remember. Safe sex is not a slogan. It is connection plus respect plus science applied consistently for health, dignity, stability, and long-term happiness together, shared. Consider couples where one partner lives with HIV but maintains an undetectable viral load through consistent care and adherence. They share real lives, real affection, and normal intimacy anchored in facts, not whispers or fear. The principle is U equals U. Undetectable equals untransmittable. When viral load is consistently suppressed below detectable thresholds, sexual transmission does not occur, and that data has been replicated across diverse populations and circumstances. Medication is the backbone of that freedom, because adherence keeps the virus quiet, the immune system resilient, and the pathway of transmission closed. Pills and injections become quiet guardians supporting ordinary moments and extraordinary trust. Honesty is the oxygen of safety. Share test dates, medication schedules, and any lapses immediately, because problems grow in silence and small issues stay small when spoken early, documented clearly, and repaired respectfully together. Respect shows up in practical ways, like condoms and lubricant when advised, scheduled labs, and pausing if irritation or bleeding appears. Respect is not romance's opposite, it is romance's infrastructure, invisible until something goes wrong. Connection is the reason technique matters. Touch becomes calmer, decisions become slower, and both bodies read signals accurately when fear abates, because caring attention widens awareness, lowers pressure, and lets consent remain curious, warm, and alive. Love is not dangerous when guided by truth. Danger lives in denial, secrecy, and rushed choices, while love flourishes wherever data, dialogue, and disciplines meet, leaving room for joy without bargaining against tomorrow's health. You isn't just science, it's freedom written in data. A reminder that evidence can lift shame from bedrooms, replace superstition with stewardship, and give couples permission to build futures both passionate and prudent. If you've stayed with me this far, don't stop now. This 60-second ritual turns caution into confidence and keeps your barrier strong after the moment ends. Think of it as a safety habit, not punishment. A calm routine that respects skin, nerves, and mucosa, so protection continues while heart rate returns to normal. Step 1. Rinse gently after intimacy with lukewarm water and a mild, pH-balanced cleanser. Avoid scrubbing, alcohol wipes and soaps that strip oils and create invisible microcracks. Step 2. Pat completely dry with a clean towel reserved for you. Never share towels, and dry the glands and under the foreskin to discourage moisture and fungal overgrowth. Step 3. Moisturize lightly with aloe gel or an unscented lotion. Aim for supple tissue that resists friction, not greasiness that traps heat or irritants against delicate skin. Step 4. Drink a glass of water, stretch hips and lower back, breathe, and let the pelvic floor relax so circulation and sensation recover without strain. Dispose of protection discreetly, wash hands, and store condoms and lubricant in a cool, dry place away from sunlight and car heat for reliable supplies next time. If you notice dryness, friction, or spotting, log it in a notes app and plan adjustments. More lubricant, slower pace, positions, or grooming a day earlier, reducing irritation. Do a 30-second check-in with your partner. Discomfort, redness, or reason to pause sooner next time. Clarity now prevents worry later and deepens trust without post-mortem debates. This ritual isn't obsessive. It is professional care for the body you depend on, intimacy, identity, and health. The way athletes recover so performance improves rather than declines. Remember the mantra I keep in clinic and teach patients. How you finish matters as much as how you start, because recovery choices seal the protection you began earlier. Practice this for 2 weeks and notice calmer skin, steadier confidence, and fewer what-ifs. Small, consistent behaviors are medicine, and this 60-second habit is the practical prescription I can give. Let's recap in clear terms, gentlemen. The first technique is the timing rule. Respect testing windows after potential exposure, and be patient enough to let reliable results guide decisions instead of panic or rumors that push you into risks you never intended. Second, practice the double barrier strategy. A well-fitted condom plus the right lubricant prevents micro-tears, reduces slippage, and turns latex into dependable protection that feels smoother, safer, and more sustainable across real situations and relationships. Third, build the test and talk habit. Share last test dates, schedule checks every 3 to 6 months, and keep records because transparency converts anxiety into data and lets adults choose wisely without defensiveness, secrecy, or avoidable misunderstandings later. Add the foundations we covered: strong immunity, gentle hygiene, and a mindful 60-second recovery. And you own a complete, doctor-designed protection system that becomes effortless, not fearful, because it lives in routines rather than emergency reactions or superstition. Remember, safe sex is not the absence of pleasure. It is the presence of intelligence, respect, and skill, where confidence replaces hesitation and technique honors intimacy, so both partners feel seen, protected, and free to enjoy the moment fully. Men who follow these habits do more than stay negative. They remain steady under pressure, communicate clearly, and earn trust that deepens affection. Because consistency is a quiet signal of character people recognize without being told. Carry this forward tonight. Slow is safe, clarity beats guessing, and preparation multiplies protection. So your choices build health and dignity now, while your future self thanks you for discipline practiced when it mattered most. If you found one insight that changes how you protect yourself, please hit subscribe. One click helps us reach the next man who needs calm instead of confusion. Stay safe, stay smart, and stay proud of caring for your health.